What can parents do to help keep kids safe from COVID-19, particularly as they go back to school? Great question, and I know this is on everyone's mind as COVID numbers are increasing substantially among kids. To give some context, nearly 72,000 children and teens caught COVID-19 nationwide during the last week of July, mostly the new highly contagious Delta strain. This is about 5 times as many kids who were sick at the end of June. So regarding the Delta variant as it relates to kids, here's what we know and don't know so far. We know that this strain is far more transmissible or contagious than previous strains. What we don't know is if it is more likely to cause severe illness in kids. But due to how contagious it is and the fact that children, at least young children, aren't able to be protected themselves with vaccination yet, we know that we are now seeing a significant surge in inpatient pediatric floors and intensive care units all across the South, including Virginia, where there are kids as young as a few months old who are sick. So while severe COVID-related illness in children has been uncommon prior to the Delta variant, it's critical that we recognize that this Delta strain is very capable of causing severe illness in even healthy kids. Combining the fact that the Delta variant is so contagious and that some of our children's hospitals are filling up and we haven't even started school, all of this together has the pediatric community concerned at this time. We see the recent spike in pediatric cases and hospitalizations as a flashing yellow warning sign that we should double down on the following effective, safe, proven methods to help protect our children. As a pediatric community, we know we still want the kids back in school at this time, but it is imperative that we do so safely. So, what can we do? The number one thing we as parents need to think about is the vaccine. I would strongly urge parents, caregivers, family members, adolescents 12 and over, and teachers all to get vaccinated. Doing this helps create a protective cocoon around our kids who aren't yet able to be vaccinated and are an increasingly vulnerable population. Additionally, we might want to talk to anyone interacting with our kids about their vaccination status. If the person isn't vaccinated and the parent still feels okay about having them around their unvaccinated child, at least kindly ask them to wear a mask or even consider asking them to get a test prior. As one of my pediatric colleagues, Dr. Maldonado, a pediatric infectious disease doctor at Stanford, said, "You wouldn't want your child in a car where someone was driving without seatbelts or without a driver's license, so we shouldn't be afraid to stand up for our children's health." In terms of reducing spread, we as parents should teach our kids good hand hygiene, to cough into our elbows, and to try to keep some physical distance. We can also think about maximizing time spent outdoors and wearing masks when indoors. Regarding masks, the American Academy of Pediatrics, AAP, recommends everyone older than age 2 wear a mask when returning to school, regardless of vaccination status. The data strongly supports that masking is a very effective way to prevent infection. Go ahead and get them a mask with their favorite superhero on. How do we talk to kids about the virus? Kids are perceptive and smart, and even 2-year-olds can pick up on changes in their environment and emotional cues. With younger ones, we might tell them that the virus kind of grew up and has gotten a little bit stronger, so we have to fight a little bit harder. With older ones, I would be direct and state the facts and let them know that we are doing what we can to help them and keep them safe. Also, we can try to keep the dialogue open and encourage our kids to be open with us, especially if they are not feeling well, so that we as parents can keep them home and remind our kids that staying home isn't a punishment, it is to keep people safe. There's a lot of information circulating, and unfortunately not all of it is accurate. Your child's pediatrician is the best source for information. They know your child's medical history and can answer your specific questions based on this information and the latest COVID data in the community. Thank you.